Speaking against the motion, John Stossel, my colleague from ABC News, but we did not discuss this ahead of time. In fact, though both of us have worked a quarter century at ABC News, we've never met until tonight. Bizarrely enough, separate orbits, I suppose. I kept my feet on the ground. John Stossel's hard-nosed take on many a liberal policy assumption is summed up in his catchphrase, "Give me a break." Tonight, in a sense, we're discussing what if you break your arm or your neck. Should the federal government be there to provide your insurance safety net? John Stossel here to argue against that idea and the motion tonight.
It is intuitive to think that it should, that we have the very poor and helpless people, and it's the job of government to help them. And actually, we have that. We have Medicaid. If you are poor, you are covered in America. It's not a good system. It's tempting to think that a wise government could step in, and Paul Krugman has just said, look at Medicare. People like Medicare. And that's true, but of course they like it, because it gives you stuff free. People like that. But it's unsustainable. It's $35 trillion in the hole. That's the unfunded liability of Medicare. They made promises to cover us when we're 75, when the panel is 75. There's no way they can possibly do that. Right now it's working because there are lots of young people and relatively few older people, but there's just no way it can be sustained. If a private company tried to run its pension system that way, I bet they'd throw the owners in jail. It's a Ponzi scheme. Now, some people will talk tonight about the widely publicized data that America spends the most on health care, and we do, and studies have found that we have the worst result. But those studies are deceitful. They compare us by how long we live. But Americans are different. We drive cars more. We kill each other more often. Our accident rate, deaths on the highway, is triple that of the United Kingdom. We murder each other 10 times as often as the United Kingdom. When you take that out, we live longer than those other countries. And that doesn't even include diet issues, because we eat more, and that kills people. A lot of these studies are skewed to make America look bad. Now, many people say that the perfect system is in Europe, where you have universal health care, and it's true. Most other countries do have systems like that. And it gets rid of the horrible anxiety that some people have in America. Will I be covered? And that is horrible, and that does make people sick. But it's better to be anxious than to be in horrible pain or to be dead. And these universal coverage systems, they don't guarantee universal access to actual care. In Canada, more than 1 million families can't get a doctor. We taped in one town in Ontario where they have a lottery. They have a little box. Everybody puts the family name in, and the town clerk pulls out a name. Oh, you get to see a doctor this week. There aren't enough doctors to go around. In Britain, 1 in 8 patients waits more than a year for treatment in a hospital. The journal Clinical Oncology says 20% of potentially curable lung cancer patients become incurable on the waiting list. Now, why does this happen? Well, because when everything is free, when the government pays for it, everybody wants everything. But the government doesn't have infinite money, so the government then must ration. And they do it by not giving you the latest, most expensive stuff, or they make you wait in line. In one town in England, they opened a new office where you could get dental treatment. People lined up for blocks. Now, most of them didn't get in, so people pull their own teeth. The dental tools are pliers and vodka. So it's not a good way to live. Still, despite the fact they spend less, European care is not remarkably inferior. It's pretty good for most people. But that's true only because they freeload off of us. Because most of the innovation comes from America, from the greedy, profit-driven companies that want to take as much money from you as they possibly can. They're the ones who gave us so much good stuff, the MRIs, the CT scans, ACE inhibitors to lower blood pressure, the statins like Lipitor to reduce cholesterol, coronary bypass surgery, hip replacement, knee replacement. What will the world be like if we have universal care and we don't have America to invent those things? Yes, the private market is awful in many ways and wasteful. Health insurance companies waste all this money on advertising, paperwork, duplication, claims officers trying to make sure you're not cheating them. It is intuitive to think a single payer would be more efficient. And Michael Rachlis, who will speak shortly, has written that a public bureaucracy is cheaper. And I used to believe that when I attended Paul Krugman's university. I was taught that the wise elites in Washington and state capital can plan these things better than these competing companies. But then I became a consumer reporter, and I watched the market work. I watched government and private greedy companies trying to deliver services to people. And now I say that's nonsense. Government can't do anything even close to the efficient way that private companies do it. When government pays for things, people don't change. They don't innovate. They keep doing the same thing they did to get paid. So, as an example, look at the inefficiency of the private car companies. They waste millions on advertising on my program. I'm glad they do. And they run these gross ads. They sell cars not based on their engineering, perfection, or safety. They sell sex and muscle cars. They have these competing dealerships and pushy salesmen selling things like rust-proofing that we don't need. Despite all of that, what's the worst you get when you buy a car in New York? I mean, the worst you can get is better than this. This is what the planned economies, universal coverage gives us. And I apologize to those of you on the radio. You can't see I'm holding up a picture of the Trabant, that East German car. This was the best those brilliant East German engineers could produce. It was an awful car. You had to put the oil and gas in separately and shake the car to mix them together. As soon as the Berlin Wall went down, this disappeared because it couldn't compete with the mediocre products that were produced by our competing companies. I don't want to have this kind of health care, and that's what we'll get if government runs it. At the beginning, government can do things well. You get the Peace Corps, New York's public schools, but after a while it deteriorates because they don't change, they don't improve. Maybe once every 12 years they change a little. If we have universal health care, this is what we'll get.
Thank you, John Stossel.